Did you know that from a 2021 National College Health Assessment Survey from the ACHA, they found that 22% of students reported that they were being diagnosed or treated for depression in the last 12 months? That's because too many students are going through mental health issues, and I feel as though we are not doing enough for ourselves. As a result of that, one of those is depression, which leads me to bring you the study of 2020 from a psychiatry research center, as they surveyed that over 1,800 college students have depression symptoms, and they found that 27% felt that they were hopeless, 17% felt depressed and saddened, and 14% felt so depressed that their everyday function became very, very, very difficult. This is usually to factors such as academic pressure, such as heavy workloads, demanding courses, and pressure to succeed and pass. Also, financial issues like tuition costs, student loans, and also low paying jobs. Loneliness, as people are being isolated from their families, their friends, going to a different state or different place. And relationships, as the dating scene isn't all that great nowadays. And also health problems, because there's things such as lack of sleep and a lack of a diet, and people are not exercising. For me personally, I'm also a victim of poor mental health and experience difficulty doing my day to day things and functioning just every day, such as eating or not exercising, and it becomes just a chore, and I just want to lay in bed and do absolutely nothing. So, as daunting and embarrassing as it is, I feel it's best for you to go and talk to an expert, or go to your local counselors, your local school counselors, or even a professional therapist, as you wouldn't be alone either. As a study says that from 2021 from the NCHA, that they report that within the 12 months, about 21% of college student responses went to therapy or college counseling as for their mental health concerns, not even for classes. And I feel that helps even me, as it helps me reduce my stress and anxiety, and it gives me a platform and a place to talk about my problems that isn't just my friends or my family. So, in most instances, it's even proven to improve and help students, as a research published in 2020 from the Journal of Counseling Psychology. They surveyed that college counseling service users found they had a decrease in anxiety and depression when students attended at least three sessions, and 84% reported that it was effective after these 3 sessions. So it's not exactly a definite solution, but it's an option for you, at least when you're in a desperate place. As for myself, I've also gone to school counselors, not just for planning classes, but to also talk about just my life, my difficulties, my passing of my loved ones, and being able to manage just my life and how can I go about going to school. And they've helped me kind of pace myself to give myself time to adjust to life, to college, while also still progressing in my academic career as an engineer. So that brings me to my call to action. As many people, as myself, a victim of mental health issues and not really wanting to talk about it, if all these things describe you, I recommend you see a counselor at your local school, or even a professional therapist, and talk about yourself. Talk about how to combat these things, and they will give you options, as they both as their job and also because they care about you and they want you to succeed. And as daunting as that sounds, it will help you heal and at least give you a platform to talk about yourself and your life. And it's helped me personally, as it's reduced my stress and it's allowed me to combat school and combat life. And maybe you guys need the same, and I hope you reach out and try it. Thank you for your time.